Bore da pawb. Good morning, everyone. Thanks for the organisers for inviting me today. As mentioned, I'm going to just talk through patterns and trends in the mental health and well-being of children and young people in Wales. Just to recognise that this is very much a snapshot, and there's a lot of data we could include in the presentation and in particular subgroups and specific conditions, but hopefully this gives some kind of insight into recent trends. Before going into the data, just to recognise, as already mentioned by both speakers, we all know this is a very crucial stage in terms of development of mental health, positively and negatively, and there's a lot of influences on young children at these ages, and then if we can really have some positive influence, then we know that when we get to adulthood, we can hopefully prevent a lot of the mental health illness prevalence we see. The image on the left is just a reminder that sometimes we look at mental health with a negative lens, and that we must also recognize some of the positives. So it's not just the absence of illness, but all those opportunities we can to positively influence the children. The second slide, so this is available on the HAPIS website now. So this is the accessible mental wellbeing framework, and it just covers some of the important influences that can affect children and their mental well-being. So it's broken into the individual and the community. And again, if we can have an impact on some of these, then we believe that we can have a really positive influence of children of all backgrounds. So most of the data presented, it won't be clinical data, it'll be from the Shern survey when it's specific to Wales, otherwise it'll be from the MHCYP in England if that data doesn't exist or wasn't included in this presentation. So this is looking at mental well-being of adolescent children, and as we can see when we're looking at all, irrespective of 2021, which is the turquoisey colour where there's a spike relating to the pandemic, we can see an upward trend. So we're looking at currently 1 in 5 children are reporting low mental well-being. If we look onto the right, so that's children who neither were described them when asked if they were a girl or boy, then we can see a big spike, so almost 50% or just above 50%. Again, irrespective of the spike that we saw with the COVID pandemic in 2021. And again, we can see that worsening trend in terms of high mental well-being, so going down towards 10%. So quite a difference in terms of all, and then those who reported neither were describing them. This data, so on the left here, this is the influence of family affluence. So we can see in 2019, the difference was about 10% between those from a high affluent family and those from low affluent family. In 2023, it's gone up to approximately 13.5%, so a slight increase in the difference or the inequalities that we're seeing between those from high affluent families, and low affluent families. On the right, this is by school year. So again, as many would recognize, there's big differences between girls and boys and how they're reporting, and especially in that kind of year 9 and year 10. So a slight decrease in year 11, but year 9 and 10, it seems an increase up towards 20%, where girls are reporting much higher mental health illness on the SDQ questionnaire. So this data here, this is from the Clinical Practice Research Data Link. So this is specific to England. And this goes back to 2003, so a bigger time frame, 2003 to 2018. And what we're seeing is obviously the higher prevalence in those older age groups, increasing, maybe a slight kind of spike from 2008, 2010, but not huge. And this is for depression. Again, the same with boys, so the prevalence not as high, but for both girls and boys, the actual increase, the relative increases, although smaller in terms of incidences in those younger age groups. So they're, 6 to 9 and 10 to 12. When we look at anxiety, then there is a much more noticeable spike. So kind of 2010, 2012 onwards. So maybe not things that happened in those years specifically, but if we look back in the preceding 10, 15 years, then maybe we can take that kind of wider lens and think maybe what changes may have influenced those kind of, because that's quite a considerable spike. Again, for boys, not as high in terms of incidence, but similar kinds of patterns to depression. So those older age groups have the higher incidence, but in terms of relative increases, it's the two younger groups. So this is data again from England using the ALSPAC data set and the Millennium Cohort Survey. So ALSPAC would be those children born in 1991, 92. Millennium Cohort is then 10 years later. So we can see the most recent data set. So the MCS has a larger spike in terms of from kind of 7 and 8 years old, and it maintains for longer. So the earlier age group, those born in 1991, a slight increase kind of 5 to 7 years old, but then it stabilizes. For the later age group, that kind of adolescent years, we can see an increased spike and higher scores on the STQE, which is emotional problems. So we'd be factoring in depression and anxiety. And just to say, sorry, going back to that, if we do have the graph, I've got it with me, it's not on this presentation, but if we presented that for girls, it'd become even more exaggerated. So the blue line you'd see go far higher and a much bigger gap between the two data sets. So this is from the MHCYP. So this is in terms of hyperactivity disorders. So for the most part, these haven't increased or seen a big increase. And I know in Wales, in terms of referrals, there is data that goes against this. But in terms of the population level surveys with children, there hasn't seen a similar increase to what we've seen in emotional and behavioral disorders. And there is a meta-analysis on kind of a global level that supports this and data, similar kind of patterns across, I think it was 20, 30 years as well. So this is looking at eating disorders. So again, along with those emotional and behavioral disorders, eating disorders has seen a spike, and primarily driven with girls. So that 17 to 19-year-olds, we can see that the all is mostly, I think, so girls looking from 2017, I think it was 1.5, 1.6%, and that spiked to 20.1%. So quite a significant increase. And again, boys are seeing an increase, but much more prevalent in girls. So this data is looking at those who are unlikely to have a disorder based on their findings and those with a probable disorder based on their findings. So it's not causal data in that it's not saying that if you have a disorder, this will have the effect. It's just showing an association. So we can see for loneliness, for those who have a probable disorder, irrespective of the age, so this is 11 to 16 and 17 to 22, big increases for those with a probable disorder. Sleep problems, again, a known predictor. So in this one, it's got possible and probable, and we can see that there's a clear pattern towards those with a possible or probable disorder. Over 50% will have sleep problems, which we know as an association with mental health and poor mental well-being. So this is bullying, again, the same kind of data, so unlikely to have a disorder and probable disorder. Again, big differences, so less than 10% of those unlikely to have a disorder would have been bullied in person. For those with a probable disorder, it goes above 30%. And just from memory from the Shern data, there's been a small increase, so I think it's towards 30% of reported bullying in Wales, but a very small increase in recent years. But yeah, so this is bullied online, bullied in person, and bullied in person online, all showing similar kind of patterns. Again, I think this is going to get spoken on today, or touched upon at least, but we'd expect to see these kind of patterns, so I'm sure most in the room would recognize these, but same kind of data. Those unlikely to have a disorder, engaging in exercise, in that social environment, in group activities, when we look at unlikely to have a disorder, there's quite a drop off. And then these are feelings about the future. So all this data on this slide is for those that were identified as having a probable disorder. So we can see in terms of being optimistic and somewhat unworried about the future. It's kind of worrying when we look, especially again for girls, a more worrying situation. And this can be separated then for climate change, financial insecurity, a whole host of different variables that all show similar kind of patterns in terms of those with a probable disorder and seeing their future more negatively. And this is just an image that Emily, the consultant lead, attached, though it's important not to focus on the children and the individual as the problem, but trying to think wider, trying to think what might be happening around them, how we can offer. And I know across Wales, people are doing amazing jobs. And there's a nice little image she wanted to be included. And yeah, just to emphasize that many in this room will be part of these programs, but the great work that is going on, I know a lot of the data may come across as negative, but when you compare it to some other countries, and it's in a really good position. There's a lot of work now doing where we're putting the, person-centered, putting the child first, and empowering the schools and the teachers, and it's hopefully having a really good effect. And the next slide, although not hugely significant, does show some positive signs, especially in that year 10, where it's a significant increase. So looking very short sample size, 2021 to 23, but there is some indications that some of the work that's going on is starting to have a real positive impact with the children. And the last slide, again, as Emily will always preach, it's important that for all of us, we always keep mental well-being at the forefront, the little things that we can do on days like this where we might be sat around, just whatever the background, whatever we can do, just take those little minutes or moments to recognize that we have to look after each other and ourselves.